those that are here, thank you for joining us. And those that are still here to join us, thanks for coming. We'll be waiting for you, but you'll find us on our way. We don't have much time. So today I'm having Dr. Motsuki Simon there. He's currently okay. He did his internship in Klerksdorp, and I'm not sure. I forgot. He told me where he's currently doing his concept. So he was also in Medusa 2018. So yeah, Dr. Motsuki, if I missed anything there, please add there.
Yeah, now I'm in. So yeah, I did my internship in Klerksdorp and Tshepong. They call it KT Complex. So now I'm doing my concept more Elizabeth Hospital. I'm in Palale.
Oh, in Palale.
Yeah, it's a district hospital.
Oh, okay. So I just want you to understand in terms of you applying those 5 hospitals, and was Klerksdorp one of them, and what were the rest for?
King, you want to know all my 5 options at the time?
Yeah, I don't know. You find that maybe you were thrown into a hospital that you don't want to see, or the hospital that you like, hey, yeah.
Okay, me, KT Complex was my first choice.
Yeah.
So I had heard it before from, Dr. Mokhazi. He used to be the general surgery.
Yeah.
I think now he went to UP, Adravascular. Yeah, so he told me because then he went to vets as a student. Then it's like a KT Complex, vets second, kind of like it's like JST and Medunsa,
Yeah.
Yeah, and vets, yeah. So KT Complex is the same, so it's vets second. So he told me because you see, now I want to be a surgeon. So he was like, there it's a very good place for you, so you can go there. And then that's why I chose it as my first choice.
Oh, I see.
So my second choice.
You want to be a surgeon?
Yeah.
Continue. I didn't know.
Surgery.
Yeah.
Oh, I know. General surgeon in the next maybe 5 years. Let's see.
Yeah.
Yeah.
Yeah. Now you can continue. You can continue. I got.
Okay. So yeah. So when I applied, so I did Northwest because it's in Northwest KT Complex.
Yeah.
So I did Northwest as my primary province. So meaning I had to choose too many options from there. So my first one was this thing, KT Complex. And then I think I had Potchefstroom, which is close to Klerksdorp. And then I had 2018 was a very long time. I had what else did I put there? Oh, Leratong from the one in Gauteng in
Klerksdorp.
Yeah, because they also said it's a very nice hospital in terms of Tolen. And then I didn't have any Limpopo things in my options, like any Limpopo province. I think I had Woodbank.
So I want to find out with the information, this one, like a lot of people talk about this hospital, Poch, the Rato. Like what's up with them? Because I might not be able to get into like find people from that side, but if you can just say why those hospitals? Was it because of the learning experience you wanted in Klerksdorp?
Yeah, so remember now when you are done, the most important thing, to me, the most important thing was after my internship, I wanted to be a competent doctor. Not to know everything, but at least to be comfortable in almost everything. You see. So KT Complex will give you that, Leratong will give you that, even Sebokeng in Gauteng will give you that, JST will give you that. So now after like my classmates went to others, even though Ferreira will give you that. Temba, I'm not sure. And then even Mankwing and Polokwane. So Kimberley is also one of the best, but it's very far, you understand. Yeah, but Kimberley is also but Kimberley is also very good in terms of, like, remember, in everything you do, in every rotation, you want to come out of there able to can treat all the emergencies that are there in that discipline, and like you need to know stuff, you understand. So for example, in peds, ops and gynae, whatever rotation you are in, after you're done with your 3 months with you guys, like for us it was 4 months, you need to have learned something. So all those hospitals I mentioned, I'm pretty sure like after you come out of a rotation, you can go into ComServe immediately and then you'll be fine.
Oh, okay. So no, I get it. I remember Pushia talked about it to say that, you know, there were 2 types of interns. You know, we got those that are more academic, who want to go study, and those that just want to relax. So I think those hospitals, they're more of academic, and, you know, people like us, we want to make sure that
not really academic, because even if you want to be a chronic MO, for example, you as an MO, you must also know like basic things in medicine. You understand? You must be able to treat the patient. You must be able to know that this patient needs to go where. You see? So look, if you want to relax in internship, man, you can go to level 1 hospitals and all. But for me, I feel like internship, whether you want to be academic or not in the future, but you must learn in internship, you understand? So even if me, I wanted to be a chronic MO, I would have still went to KT Complex because of the learning I got. I feel like I would have been a competent MO-ish, kind of like for the coming years, you see, from the knowledge I took in internship. That's why internship is very important. So whether you want to be academic or you don't want to be academic, choosing a hospital where you want to do internship, not that now you want to go to a level 3 because you want to be academic. No. Even if you want to be a chronic MO, remember, the main goal of internship is to learn. That's why there is internship, you understand?
I get you.
So, but if you want to relax, you can go to other things. But then, man, I don't know. Some of us, we don't think like other people, you see. So at the end of the day, remember, we want to help patients. You want to know a little bit. You want to have an idea at the end of the day, you see. So you have to go to a hospital where you are going to learn and learn enough to can like work independently.
I know, I get you. Marana, when we go to the Klerksdorp Hospital, KT Complex, like I know this is the most important question. Like why I'll ask in a way that you say, why should someone choose KT Complex or consider it?
You see, I won't lie to you. KT Complex, for me, it's one of the best places you can go for internship. You see? So when I chose it from word of mouth at the time. You see? So the guy told me, Mukhaz is like, go there. There you'll learn, you know. At least when you go there, at the time was like, when you want to be medical, they will channel you in that direction. When you want to be surgical, they'll also channel you in that direction. You see? So, and remember in KT Complex, they take too many interns. So in a group, for example, we're like 14 interns, like first year and second year interns. You see, I got it now, our internship program, it was the old one. It's not the new one where you do things 3 months. Yeah, so we had second year interns. You guys, when you go there next year, you won't have second year interns, you see. So KT, for me, like there's no department that I can think of that lacks. It's like a tertiary hospital in a way. There's only a few things we sent to Baragwana when you are in KT complex. So every rotation, they've got at least 2 consultants, you see.
Yeah.
So you have, and then you rotate in almost everything that you do as a student, like ENT, whatever. Other places you won't rotate in ENT, ophthalmology. What is the other one? Oh, no, anesthesia gonna you do, anesthesia gonna you do, yeah. So you're rotating ENT and ophthalmology in KT complex. I haven't heard other people saying they rotated in ENT and then they rotated in neurosurgery, you know, urology. You understand? So for me, like when you go there, like there's no way you go in, like even if like you're hard, like you're saying that I don't want to learn, you will learn by force. You see, because it's like you're going to be forced. Not that they will be telling you that no, because you'll be working and then things will just be coming to you. You'll just be forced to know them. You understand? I see. So yeah, if you want to learn, you go to KT complex, and then you go to the others that I mentioned. But number one must be KT.
There's a question here. Rather, how many people get their first choice hospital? I don't know if you have that knowledge. Like usually,
how many people
get their first choice?
The question.
How many people get their like if now I'm applying?
I don't know, but you see, for example, it depends. Because you see, my KT was my first choice, so and then I got it. You know why I got KT? Because as my first choice. In KT, they take 40 something interns.
Yeah.
So the chances of you getting it as a first choice when you put it are very high. Because even they took people where KT complex was their 5th choice, others it was not even their choice. Because even if you don't choose it, remember they take 45 and you find that as first choice, we were not even 20 or something. So obviously they are going to take everyone that took KT complex as their first choice. And then they go to those that they put it as their second choice and then they didn't get their first choices. Because obviously if you put it as a second choice and you get your first choice, obviously they're not going to consider you see. But if you put it as a first choice, it's very high that you're going to get it.
It's a very challenging, you know, especially when you have 2 hospitals that you like to go to. You don't know which one.
Yeah, then not to me, you know. Now I'm a guy or a person who usually when I want something, I make sure that like I go there. So at that time, I didn't have 2 options. I only had 1 option where I wanted to go as an intern. It was KT complex. And then the others, I just put them there just because if I don't get my first choice. But I didn't have a situation where I wanted to go to KT or I wanted to go to JST at the same time. You see. So because before I knew about KT, I wanted to go to Leratong. You see. Yeah. Then after I knew about KT, Leratong went very down. And then KT went up for picking orders, you know, then it was top of the list. Then I applied to it as first choice, you see. So that's why I made sure. You see, that's why I even made Northwest. I'm not from Northwest, mind you, but that's why I even made Northwest as my primary province to like up my chances of getting KT as my first choice.
Well, what do you mean primary province? Like will you stay there?
No, like when you apply, you will see there. It's primary province, secondary province, tertiary province, and then they will be like you must choose I don't know if it's at least two hospitals from your primary province. You can choose a maximum of 3. You see. So when you make it as a primary province, it's like, I want to go to this province. So even if you don't get your first choice, then they will look for you a hospital in that province. You said like, I want to go to Northwest. Yeah. So then they give you hospitals in Northwest.
Imagine if I want to go there to Northwest for JST. Then I don't get JST. Now I'm in Klerksdorp there.
And then you are stuck there. I know it's not nice.
No, it's not.
But you can still make it as your secondary province and put JST as on top of your list. But now you see you're also limiting your chances. You see, so I don't know how well that work, but because even JST, remember, they take a lot of people. So if you put JST as your first choice, chances are you're going to get it as your first choice.
No, because it makes sense the way you're putting it in terms of the primary, because I know one guy, they didn't apply. Like there were a few guys in George, there were a few guys in Mamelodi. Those guys didn't apply for those hospitals. But I think it was the same concept of the primary province. Then they just had to throw them there. Yeah,
unfortunately.
Okay. I'm not sure this question. Maybe I'll ask Romeo to ask it again, because it's asking, please ask to explain the internship program. I'm not sure which one it's referring to, the current one or the old one. But just let us know, Romeo, if you're talking about the current or the old one. But Motsuki, now, in terms of
because I can also give, like every rotation.
Yeah, let's go.
Yeah, like in terms of that, So I will take it like the way I did my blocks. So that I don't forget like other disciplines. You see. So I'll take you through my internship. So 2019 internship. So then 2018 got email that I'm going to KT Complex. I was very thrilled because, as I told you, it was my first choice. Then I made plans to go to Northwest, Klerksdorp. It's a very wide, like Boer town, small, but very safe. It has a few staff, but obviously it's not Pretoria or Joburg,
Northwest,
So I feel like even Rustenburg, it's a better town compared to Klerksdorp. So it's like 2.5 hours from Joburg and Pretoria. So I was like, nice, fine, I'll go there. My first block was Pediatrics. And lucky enough, I had finished with Peds in my final year. So my last block was Peds, and then my first block as an intern was Peds. So at least some other things were still. No. So the nice thing about Klerksdorp, they are very, very, very organized. Before you even get there, you already know what rotation you're going to do. They ask you about your leave plans, even though I feel like that one is weird. You don't know your plans for next year, for example. But they already ask you for your leave plans, that when you must send us your leave dates. You have got 22 days of leave. Send us your leave requests and stuff so that they can see. So first things first, they will tell you, like, you'll be in this group, and then they'll create a group. So that was December before we even started. So you already knew the people you're going to rotate with the whole of your internship, Then they create a WhatsApp group. We're there. Then they tell us, like, our reps. So usually the rep was the second year intern. Because already they've did first year intern, they know how things work, They're the ones who made call rosters and things. So after the group, then they tell you your rotations. Then they're like, you guys will be starting with Peds. So I knew I was going to start with Peds in December. Then after, they're like, okay, well, we want your leave plans. Then we sent our leave requests. I only sent a leave that I don't want to work on my birthday week. I think that was the only leave request I sent. The others, I was like, you can give me any leave dates, it's fine, you know, because then they will look there. Then I was like, my leaves, I want them 5 days. Like, I don't want to take 10 days. That was first year. So 5 working days from Monday to Friday. So, and then in Klerksdorp, you can't take leave. Like, you can't, like, your leave cannot start on a Wednesday. Even a roster, it doesn't start on a Wednesday. So every roster, every rotation, every leave, it starts on a Monday. So when the week is starting, you start a new life in a way. So you can't finish a block on a Wednesday, you know. Yeah, even a call roster doesn't finish on a Wednesday. So for example, if the 31st it's on a Wednesday, that call roster, it's either it's going to extend up until the other Monday. And then that's when a new one will start. So meaning probably maybe that one will end Sunday, probably maybe Sunday is like on the 4th or something. You see, and then they start a new call roster on a Monday. Or they finish it early on the Monday before the 31st. And then the new roster starts like that. So even rotations are like that. So for example, I think my PG rotation, we finished on the 28th of April. Other hospitals, they don't do that. When a month finishes and then it was 4 months, whether it's Tuesday or it's Thursday, it doesn't matter, you exchange. In Klerksdorp, it's not like that. So
okay.
Yeah.
I
so
wanted to go to the PED side,
Yeah. So my first block was PED. So we were doing 4 months, so we already knew. So what they do also is, because we were first years, we're not allowed to be on call for the first 2 weeks. So you just go to work so that you know what this working environment entails and all those stuff. PEDS, they've at the time they had 3 consultants. 2 consultants which were permanently there. So on the 2 consultants, obviously the other one was a head of department. And then there was another consultant who was sessional. He works in private, but he does calls there, even what rounds. Yeah, so PEDS was very nice because the MOs there, like, they were very supportive, you know. And then they had 2 regis. So the regis, they rotate, they are from vets. Like I told you, it's vet second. So all the regis, they rotate in Klerksdorp in every department. So PEDS also, they had the program. So they rotate there for like 3 months, 2 months. So there are 2 regis and a couple of MOs who were there. So obviously, when you're on call, at the time we were 14 interns. So 2 interns were on call every day. So yeah, what we used to do, so there is a general PEDS ward where they have, what's this? Like every baby, infant, children, not neonatal, like everyone above, like an infant, not neonates, are in general PEDS. So 2-month-olds and stuff like that, everyone, they're in general PEDS. And then there was another ward, or 3, which was for neonates. And then they had neonatal ICU and high care. And then like just a general neonates ward in that ward 3, because again we have got neonatal ICU for the sick ones and high care for also the sick ones, but stable-ish, and then the rest, but which are neonates, which are sick. So as an intern, for example, in ward 3, which is for neonates, when you work there, you don't see babies in neonatal ICU. Those are for MOs and concepts. And then you don't see even babies in high care. So we used to run the other side, like the back one, like where you see the babies, like the low birth weights that are still there, you know, that they want to keep up with the gain weight, you know. and other sick neonates. And then we used to do rounds with the reg, not the consultant, when you are in Ward 3. So you go there early in the morning, you see the patients, and then at around 12, the reg comes, and then you present to the reg, the patients, you do a round. And then you do ward work after, or you can do ward work before while you are still waiting if you know other things. So obviously it's neonates, it's kids, so drips used to humble us. So you after the ward round, you'll stay there. For example, you'll be done maybe after the ward round by 12, but you'll still leave at 4 because you'll be struggling with drips, So, but if you're struggling and you feel like you can't get it, you can always call your seniors and then they will come help you. That's why PITS was nice. So that was that for Ward 3. And then for the general PITS, also interns there, but there you also have MOs who are working there. So you all see the patients. So usually the MO will see all the new admissions. You as an intern, you didn't see new admissions. So the MO will see the new admissions. You will see the patients who were already in the ward. And then you make notes. When the consultant comes, you do round. So those patients, the MO saw which were new. Obviously, tomorrow the MO is not going to see them. You have to know them also, you see. Then they will see the new ones for tomorrow, you see. And after you are done with the round, the MOs used to stay there. You all share the ward work. Probably maybe they do the discharge summaries. Then you guys will try to get the bloods, catheters, do drips. So when you're working in the general PITS ward, it was nice because it's like a whole team. In Ward 3, you are only 3 interns, or probably the other time you are only 2. And when you're struggling, you are alone. There's no MO. At least in general PITS ward, the MOs are there, So they used to help. And then the others used to work in postnates. So in postnates, it's not ops people who used to see the babies there. So as a PITS intern, you also go there. You see postnates. So when you're working in postnates, you're also working in theater. So all the seasons that are done, there should be a PITS intern there all the time. So you'll be with the midwife in theater, and then you catch the babies. So obviously the midwife will do all the measurements and stuff. You just examine the baby. If the baby is in distress, you resuscitate, in the first 2 weeks, they will teach you a neonatal resusc course, which you get a certificate for, because they need to make sure that you can resusc a baby. That's why they enroll you in that neonatal resusc. You do it there. They call some lady, she comes and then she teaches you. You write a test, you pass, you get the certificate before you can even work in postnates. So that is, yeah.
I just want us to, because the way we're moving, it's going to sort of delay us, because now we're not plus or minus 30 minutes. But the way I want it to be,
sure.
It's to be the most important thing. Let's not go into details, you see, in terms of how, but the department, let me say, maybe if I first have a question to say, what is it that in the department I should be, let me say which department it's worrying and which one are the best departments. We put it that way. Let's not go into details, because once now we go into details, we're going to, yeah.
Okay, so the best one, even when you get there, if you get to go to KT, is PITS.
Yeah.
So they even vote for it all the time. They will even tell you, they will even show their certificates. So every year they usually vote PITS the best department. And then usually the worst one where people don't want to go, it's Obs and Gynae, obviously. So Obs and Gynae, the reason being the MOs. So the MOs there, they're not helpful. They will leave you alone. They're like clinic MOs. They're always gone. But when we did Obs and Gynae, because I did it in like September to December, it was my 3rd block. They had changed the system, because before it was only 1 MO on call with 2 interns. So then at the time, then they made it 2 MOs. So when the other one is in theater doing scissors, at least you got another cargo with an MO on the floor. So it made things a bit easier. But still, people didn't like it because like you'll be calling the MO and then the MO won't be there. And the other one, which is the worst one.
Yeah.
I think it's only option guy alone. Because the rest are
Gen
fine.
Surg.
So anesthesia,
Yeah.
Gen Surg. Gen Surg is just a lot of work, you know. But it's remember, I want to be a general surgeon. So to me, obviously, I won't complain. You see.
Yeah.
But like it's a lot of work. You go there in the morning at 6:30 to see patients because you must do rounds before, like after the 7:30 morning meeting, which ends at 8. So you can't, and then at 8 you must do rounds. So that's why you come early. You see the patients, then you go to.
Motsuki, your mic is off. Your mic is off. Can you hear me? I'm not sure. I've lost you here. Even your video is paused. So let me know. Okay. We're just waiting for Dr. Motsuki there and see. Yeah, I can't see you and still your mic is still off. Just change your mic there and let's see. Just to unmute there. Or maybe I can help you with the unmute buttons. Guys, if you do have any questions, please, if Dr. Motsuki is here, you can ask him to any question, you know, because I'm not certain what's happening on his mic, but his video, it's working, it's perfect. So, you know, but we just be patient with it. There's a question there. Oh, okay, thank you, Steve. Definitely, we are going to ask about the DQ, you know. And please, this video is going to be shared on YouTube, so our KV General YouTube channel. So we just need to be patient with Dr. Motsuki and see if he's winning, you know. We're talking about the hospitals, the rotations. We are talking about Gen Surg. You can't complain about it. So we're going next to the other one.
Yeah, and the nice thing about Gen Surg was the head of department there, he makes sure, because you have a theater week when you are there. So you have a theater week. So in that theater week, he makes sure that you cut something every day. So he'll even tell you after the list comes up of the operations for the next day, then he'll tell you, go to the reg, ask which case are you going to do, and then so that you can go prepare for it the night before, and then you cut the next day, tomorrow. So they are for intense cutting when you are in Gen Surg. They even push you to cut. So they even make sure, they will even ask you at the end of the rotation, did you put IC drains? How many? Did you cut? What did you cut? And then before they even sign you off, you know. And then at the end, obviously, then they ask you, do you want to come back to general surgery or stuff? You see?
So, like, they're asking about the internal, I think the DQ one will come because there's a question about the DQ internal medicine department. And then, let's get the one for the internal medicine because there are two questions that we need to, after one.
So internal medicine, what do they want to know? The block itself.
Yeah, just the way you are talking about, like, is it fine?
And overall.
Yeah.
So internal medicine also, they've got a lot of consultants there. It's one of the best departments. After you do internal medicine, there's no way you won't know anything. And they're all for teaching. So what they do usually is you rotate in a 2 monthly or 1 month, because we were there for 4 months. So you've got non-infectious wards, and then infectious wards. So your TB, meningitis, and stuff.
Yeah.
So for both females and females, so obviously it's 4 wards. So infectious for males, non-infectious for males. So meaning it's 2 wards. So it's either you rotate 1 month in infectious male, and then 1 month or 2 months in non-infectious females. So obviously you'll do both male and females. And then you also rotate in OPD, because again, now you need to see the patients you discharge. So you've got clinic days. So you do rounds like twice a week. So for females, rounds were Monday, Wednesday, and Friday. And then for males, rounds were Thursdays and Tuesdays. So the calls were horrible. So you've got an admission ward. So when you're on call, you are on call in admission ward. You're not on call in casualty. So the people in casualty will just admit patients if they think these are admissions for internal medicine. So after the patient, they'll go straight to admissions ward where you will see them. So if casualty doesn't admit anyone, then it means you won't see anyone, because there won't be any new admissions coming to the admissions ward. So, but if the patients come, you are on call, you are 2, and then there's a reg, So, but I did internal medicine when there was COVID, so the wards had increased now because we had 2 admissions ward for COVID or respiratory cases, and then for non-respiratory cases, which was for general staff. So then we were 3 interns on call at the time, So, but internal medicine, like it was also one of the rotations that I enjoyed, because I learned a lot. The consultants, they'll make sure that you know something, like demos are also nice, and then they also have regs. So they've got a reg program where there are regs who are there permanently in KT. They're like they do a 4-year, and then they're the ones who are rotating from vets. And then they have the ones that are doing 1 year reg post, and then they finish in vets. So you start your 1 year in KT, and then you finish in vets your next 3 years or 4 years.
Oh, I see.
So KT Complex, So KT Complex is more. So it's like internal medicine. We used to say they think they own the hospital, because they get almost everything. They get preference in terms of every other department, because the hospital is run by a guy called Prof. Luke, who is a professor in internal medicine. So, and the guy who's head, Prof. Ariava, it's like it's a guru in HIV and AIDS, and stuff. So they make sure that they get whatever they want in that hospital. Other departments, they don't care about them.
Oh, okay, I see. So the other question here is about you said you rotate in 2 hospitals, right? Because someone said
sorry. So Klerksdorp is in town, and then Tshepong is in a location called Joburg. So from town to Joburg is like 10 minutes or 15 minutes, depending how you're driving, but it's not too far away. So some departments are in Klerksdorp and some departments are in Tshepong. So we'll start in Tshepong. In Tshepong, it's internal medicine, it's general surgery, it's family medicine, and so general surgery, there's neurosurgery there. And which one am I forgetting? Okay, there are theaters in both hospitals, so anesthesia is in both.
Okay.
I think that's it for Tshepong. Then Klerksdorp, it's your peds and obviously obs and gyne. So you can't have babies being born and then peds it's in Tshepong, that's why they're in the same hospital. And then orthopedics is also in Klerksdorp. So, but orthopedics might move, because they said a long time ago it was in Tshepong, because you can't have general surgery and orthopedics far away from each other. So, Yeah, so they were planning for orthopedics to move back to Tshepong, but I don't think it has happened yet. So you guys, when you get there, you might still find it's still in Klerksdorp. And the other departments that are there, it's oncology, it's ENT, it's urology, and then ophthalmology. Yeah.
So tell me, you saying that you said what was the time in terms of traveling from one hospital to another one? You said 10 or 20?
Yeah, so between 10 to 20 minutes, so 15 minutes to be exact.
Oh,
so
okay.
DQ is in town, so you can walk from DQ to Klerksdorp Hospital. So if you're doing
How many
peds,
minutes?
you won't need. No, you just walk.
Okay.
DQ is here and then the hospital is here, so you just walk like 3 minutes and then you're in the hospital.
Okay.
Yeah, but Tshepong is in the location, so you need to drive there.
What if you can't? You don't drive. What if you don't?
Yeah, so if you don't drive,
yeah,
then there's a hospital transport which you can use. So you will walk to the transport department to get the transport there, which is free because you are a worker there, and then you go to Tshepong. So it's there every hour, the transport.
Oh, okay.
Yeah,
Up until
because they need, you see, I don't know about time. Because, for example, blood bank, it's in Klerksdorp, but when you are in Tshepong, you still send samples. So the transport guy goes every hour to drop them there, and then comes back with the blood, which is already prepared to Tshepong, because blood bank is not there. Yeah, and the lab is in Tshepong, where like the lab is in Tshepong. So the specimen that have been taken in Klerksdorp Hospital, they need to be sent to Tshepong. Yeah.
Oh, I see. So she was asking the living conditions at the DQ.
Oh, DQ. I know. Everyone likes DQ. So Klerksdorp DQ is not one of the best. That one I can tell you. So it's actually a flat. It has like 7 floors. So what they do there is every first year is the preferred. You don't have any money, you don't have any car. So when you're a second year intern, they tell you to move out by force because already you have started your things out. You've got a car, then you can get a place outside. You see? So that you make room for first year interns. So, for example, I was living in 703. 703 is like a 3-bedroom apartment. So we used to, and you share. So I was sharing 2 guys. Actually, they were from Edwinsa, also Haladi and Small Magazi. Maropeng. Yeah, but Small joined us later. I had already moved out at the time. So the problem there's a clean out lane.